Welcome back to Peripheral Joint Mobilization. In this second part, we will be discussing further the joint and how it relates to PJM. So let's begin. Joint motion. So let's do a review of the types of joint motions that we have. We have physiological movements, which are voluntary movements that occur within joints, meaning this is done through active contraction of the muscles by the patient, and it is visible and felt, and there is active movement. Accessory motions, on the other hand, refer to the movement within the joint and the surrounding tissues. So these are involuntary movements, and they are more in the deeper part. You can't really see them through the naked human eye, but you can observe them through um, scanning x-rays in laboratories. You can see how the joint is structured, but you can't really see them if the patient just moves. So for example, if your patient is doing shoulder flexion, you can see their arm go up, but you can't really see the bones doing the rolling and gliding, right? So under accessory motions, we have two types, component motions and joint play motions. So basically, the differences here is that joint play just refers to arthrokinematic motion. So that's what I explained earlier, that arthrokinematic refers to the study of joint motions. So it just really refers to that. Component motions, these are the type of accessory motions that accompany physiological movement. So for example, when we do shoulder abduction, there is the movement of the humerus, right? But there is also the movement of the scapula, scapular upward rotation. So that's basically what component motions are. They occur alongside physiological movements, but they're not visible and they're not voluntary. They're involuntary. So again, four main terms: physiological movements, accessory motions, component motions, and joint play motions. So these are more of just a review so that we can refresh our memory on what are the type of motions of the joints. But next we're gonna have to, in the following videos, we're gonna go deep into the indications, contraindications of PJM itself as a clinical technique. Here we are gonna go discuss the arthrokinematic movements, which I've been very excited about to discuss. So this is very important, and I hope you will try listening and understanding this part because it gets confusing. So arthrokinematic refers to joint movement, right? There are three distinct types, or three most commonly discussed type. We have spinning, rolling, and sliding. So spinning. So let's read the description here. So at point A of bone A, in contact with point B of bone B as joint moves. So there is one point in one bone, another point in one bone, and they're the ones coming into contact with one another. So it's like just spinning. So imagine one of those, what do you call it, the tabletop, like the spinning top thing? That's spinning. So one point in one bone comes into contact with another point. Next is the very important, these two are very integral to PJM, rolling. So here we can see Chris here, the boulder is rolling. Hopefully, if he manages to punch through it. So the description here is points ABC of bone A is in contact with points DEF of bone B. So how does this differ from spinning? If spinning only has one point that comes into contact with another point, rolling has multiple points coming into contact with other multiple points. That's why it's not just stationary, spinning in one direction. It's actually rolling, going to another direction. So it's essentially what you think it is, right? Spin, spinning, roll, rolling. But we're just describing it in a way that would be easier to connect with joint mobilization. And sliding is also the same thing. Aside from these two, this is a linear motion. So if you recognize this icon, thank you. I hope we can play together. So this is described as point A of bone A in contact with points B, C, D of bone B. So this just means one point of this bone comes into contact with multiple points. So how I explain this, I'm just using point A, point B. These are just my notes to be exact. They're not really the technical definition, but it just helps me remember how it differs, which is this thing. Okay. Concave, convex rule. Let's read through this together, alright? Depending on which type of bone surface is moving, the gliding and rolling occurs differently. What do I mean by this? Okay, there, aside from the fact that the concave and convex surface depends on the direction of movement, depending on what bone moves, there's also a rule related to them. And the rule states that if a convex bone surface is the one moving, there is sliding in the opposite direction. However, if it's the concave bone surface moving, there is sliding and rolling in the same direction. Okay, what do I mean by this? Okay, let's look at the shoulder joint. Most simplest of joint, the simplest of joint, not most simplest. So here we have the humeral head, right? We have the glenoid fossa, right? This is convex, this is concave. Now, rolling, the definition of rolling, which I discussed earlier, aside from just the simple terminology of something that rolls, rolling refers to the movement that follows the bone shaft. All right? Imagine you're doing abduction. So this will move upwards, right? It would move like that. So that's the roll because this would roll, right? It's moving. You would describe this as shoulder abduction. However, when this moves, this doesn't just remain stationary. This doesn't just stay in this plane, right? Because if you move this, oh my god, what the heck, Adobe? Please don't disrupt me right now. Because if you move this, if this doesn't move, this could break here. Because if you're exerting a lot of force and then you're fixing this in a position, you could break this. That's why there's also motion called sliding or gliding. When this moves, there is gliding occurring in the bone surface that comes into contact with another bone surface. Let's analyze which bone here is the one moving if we're performing shoulder abduction. The convex humeral head. Okay, now we know which one is moving. Now, according to the rule, what does the rule say? If the convex bone surface moves, that means the sliding occurs in the opposite direction of the rolling or of the movement. So let's say I perform shoulder abduction. Where do you think my humerus is moving towards? Anteriorly, posteriorly, superiorly, or inferiorly? Just you can do the action. So if you can visualize it. So when I do shoulder abduction, it goes towards superior direction. The humerus would go superiorly. Now, if the convex humeral head is the one moving, and the rolling occurs towards a superior direction, according to the rule, where would the sliding occur? Opposite. So what's the opposite of superior? Inferior. So when there's shoulder abduction, there's inferior gliding. This will glide inferiorly for this to raise. Boom. Now this differs for each joint, all right? So let's do another example. So we have the convex femur here, femoral heads, and the concave tibial plateaus. If I do knee flexion in an open kinematic chain, meaning the lower leg is the one moving, right? It's freely moving. This is the one moving. Concave tibial plateaus. If I do knee flexion, where does the rolling occur? Remember, rolling refers to the movement, the visible osteokinematic motion. If you're flexing your knee, you're bending your knee, where does this bone go? Anteriorly, posteriorly, superiorly, inferiorly? Posteriorly, right? It goes posteriorly. So, since the concave bone surface is the one moving, let's consult the rule again. It says this rolling and sliding should occur in the same direction. So, the sliding would occur posteriorly as well. Yes. Let's do another example. Example, this one. This is the wrist joint. So here we have the convex carpal bones, specifically scaphoid, lunate, triquetrum, and the concave ulnar radius. If I do wrist flexion, bending your wrist, which bone is the one moving? These ones, right? Because this is stationary if you're doing wrist flexion. So it would be the convex carpal heads. So, according to the rule, let's consult. Slides occurs in the opposite. So if I'm flexing my wrist, it would go anteriorly, posteriorly, superiorly, inferiorly, anteriorly, right? And if it's the convex one that's moving, meaning the gliding occurs posteriorly. Okay, so here's a tip to think when you're giving, because when exam questions are asked, it's not really, oh, which where's the direction of the glide or the roll. No, it's not really like that. It's more of, in PJM you have to apply that and also determine where you're gonna apply the mobilization technique. So we have to understand, we have to, when we get a case, you have to be like snap, and then you know which direction the bonus, which direction rolling gliding, because that has to be basic information before you get to the next step. Okay, so what I usually do is when I'm given a joint, let's say shoulder joint, because this is really easy to explain. I would first determine which one is concave, which one is convex. That's the first question you need to ask. Which bone is concave, which bone is convex, right? Because you already know the articulation of the joints. You just have to determine which one. Okay, I have determined which one is concave and convex. Now to determine which one is moving. Because it differs. If it's shoulder abduction, yeah, of course it's humerus. If it's scapular abduction, of course scapular is moving. So it differs each time. So after I've determined which one's moving, I determine now, where is the rolling occurring? Is it doing an anterior roll, posterior roll, superior, inferior? The trick to remembering that is that anterior, posterior usually occur in the y-axis because you're moving towards the front, towards the back. But superior and inferior occur in the x-axis because you're moving up and down. So we've determined which one's concave, convex. We've determined which one's the one moving. We've determined the rolling. Then you apply the rule. So you just have to practice it again and again and again so that it's ingrained in your memory which one's moving. And also would help if you're familiar with the bone surfaces and which ones are convex and concave, because that would very much help. So this is it for this video.